2020 Calicut College in DOCTUTORIALS. So, first of all, I would like to welcome Dr. Naveen sir, Physiology faculty of DOCTUTORIALS.
Good evening, everyone.
So it's an honor to have you with us today, sir. Welcome.
Thank you.
And I also welcome all the finalists for Tangled. And I hope you've all read the general instructions posted in the group. So right now I'll be talking about the instructions for this quiz specifically. So there will be a total of 3 rounds. The first 2 rounds will be having multiple choice questions. Each team will receive 2 questions, and each question will have a time limit of 30 seconds. 5 marks will be awarded for each correct answer, and there won't be any negative marking or passing of questions to the next team. And the last round will be a rapid fire round, and each team will receive 5 questions and will get a total of 5 seconds for each question. And 1 mark will be awarded for each right answer. I hope the rules are clear to everyone. Do you have any doubts?
So there are total 5 rounds. Like, can you clarify that?
There are a total of 3 rounds in this.
Okay.
3 rounds. So the first 2 rounds will have MCQs, and the final round will be rapid fire. Okay. And in the first 2 rounds, you'll get 30 seconds for each question. So I hope it's clear for everyone. Do you have any doubts? Okay. So I would like to ask everyone to align their cameras in a proper way so that you are seen completely and your hands are visible. Okay. So, shall we move on to the first round?
Yes. So I'm going to start with the MCQ round.
Excuse me, Mohammed, can you please mute your audio?
Yes.
Thank you.
Excuse me.
Yeah.
My teammate is not here. Can I just quickly give her a call?
Yeah.
I'm from B.
Yeah, sure.
Yeah. Okay.
So can you see me and hear me?
Yes, sir. You're visible.
Just let me share my screen. So this is the first question for team A. Can you see the screen, everyone?
Yes, sir.
Okay, secretion of the potassium by distal tubule will be decreased by metabolic alkalosis, high potassium diet, hyperaldosteronism, spironolactone administration, or thiazide diuretic administration. So you have 30 seconds now.
metabolic alkalosis D. D then. Sir, will hello.
Yes,
Am I audible, sir?
Yes, you are audible. Strong. So answer is D. Wonderful. So you have full marks, 5 marks. One more question for the same team.
Question വായിച്ച് കഴിഞ്ഞിട്ടാ point.
Yes. Question number 2. Which of the following would cause an increase in both GFR and renal plasma flow? Hyperproteinemia, ureteral stone, dilatation of the efferent arteriole, dilatation of the efferent arteriole, or constriction of the efferent arteriole.
Dilatation of efferent will cause decrease. அது பக்கா அது கிடையாது. Dilatation of afferent, constriction of efferent.
அப்ப சியா தான் சார்.
சியா ஈயா. Constriction of efferent will cause இங்க கம்மியான அங்க ஜாஸ்தியா இருக்கும். சி போமா. Option C. Sir, we'll go for option C, dilatation of the afferent arteriole.
Okay, can you tell me
Time's up.
Sorry, sir?
Can you tell me the reason for this?
Sir, because there is increased pressure on the left side, there will be like the improved flow towards the kidneys, sir. So,
okay, so if there is a dilatation of the efferent arteriole, GFR and renal plasma flow, both will increase, of course.
Yes.
And if there is dilatation of the efferent arteriole, then what will happen?
it has to decrease, sir, because there will be more, there will be less resistance.
Okay.
Okay.
If there is dilatation of the efferent arteriole, GFR will decrease, but renal plasma flow will increase.
GFR decrease.
Yes or no?
Yes, sir.
Who is causing constriction of the efferent arteriole? Angiotensin 2, isn't it?
Yes,
So
sir.
all those drugs which are like ARBs, like telmisartan, olmesartan, all those drugs are going to antagonize the effect of constriction. So those can cause dilatation. That is why ARBs are considered as the drug of choice for diabetic nephropathy or any kind of nephropathy. Okay. What about constriction of the efferent arteriole? What will happen? E.
It will cause decreased renal plasma flow, sir.
Decreased renal plasma flow. Okay. What about GFR?
It has to increase.
GFR will increase.
GFR will increase.
Actually, initially it will increase, but finally it will decrease. GFR
Yes.
will increase and then decrease. Okay. And what about the oncotic pressure? This was asked in the recent AIMS examination. If there is constriction of the efferent arteriole, what is going to on the oncotic pressure? What will be the effect?
Not
Oncotic
exactly.
pressure will increase or decrease?
I think it will decrease, sir.
Oncotic pressure will increase. Actually, see, because you know GFR is increasing initially, isn't it? So, but what about renal plasma flow? It decreases. So filtration fraction is very high. And if filtration fraction is very high, proteins will not be filtered. So those proteins in the glomerular afferent and efferent, those are going to increase the oncotic pressure.
Yes.
This was the latest AIMS question. I don't know why, but this question is very important for your all NEET PG and AIMS. Every year they're asking 2 or 3 questions on these topics. So I'm very happy that both answers of team A are correct.
Yes, sir. Thank you, sir.
So now team B.
Sir, before you go on for the question for team B, my teammate is still not here. Is it okay if you can direct your questions towards team C and maybe give us a few more minutes?
Yes, of course, of course. Anyone can opt for question number 1 and 2.
Yeah, thank you so much.
Yes.
Just, I'll wait for her to come. She'll join soon. And then, yeah, thank you. I'm sorry for the delay.
No problem. After answering of one team, if other team want to comment something, please do, because purpose is discussion here. So any team want to comment on question number 1 or 2?
Sir, in this question, secretion of K plus by the distal tubule. So spironolactone, it acts on the collecting duct and not the
Yes.
DCT. So
Spironolactone is aldosterone antagonist. Okay.
yeah.
And aldosterone is acting on both DCT as well as collecting duct. Whenever we say distal tubule, it means DCT as well as collecting duct. Distal
Okay.
nephron. Whenever we say proximal nephron, it is something else. But when we say distal nephron, it is both DCT as well as collecting duct.
Okay.
And he correctly answered that thiazide diuretic is working on what? Which channel? Can you tell me?
Yes, sir. Na plus and Ca2 plus. Na plus Ca minus antiporter.
Sodium chloride channel. Sodium chloride.
Sodium chloride channel. Yeah.
Okay. So there will be what? There will be salt wasting. Salt wasting will cause secondary hyperaldosteronemia. and that will cause secretion of the potassium. So he was absolutely correct. If you know the Gentleman syndrome, it is same as thiazide diuretic. Bartter syndrome is just like loop diuretic, and thiazide diuretic is just like Gentleman syndrome. In both, you will get hypokalemia due to secondary hyperaldosteronism. Okay, that is why it is called as spironolactone is called as what? Potassium sparing diuretic. This is the reason, isn't it? Rest all are causing hypokalemia. But if you see spironolactone, it is potassium sparing diuretic. Okay. So should I move to team B or should I wait?
So can
Maybe
you,
we can go to team C and wait for the other member of team B.
Okay,
yeah,
okay.
Team
I'm
C, are
ready.
you ready?
Thank you.
Yeah,
Team
I'm
C,
ready.
Team C is ready, na? Team C is ready?
Yeah, sir.
Okay, okay. So all the best. If the ejection fraction increases, they will be decrease in cardiac output and systolic volume, heart rate, or pulse pressure.
Ends. I would go with option B, end systolic volume.
Wonderful. Why? What is
Because
ejection?
ejection fraction is the amount of blood ejected from the heart. So if the more amount is ejected, then at the end of the systole, less blood will be.
So ejection fraction is equal to what? Stroke volume upon end diastolic volume upon
Stroke volume upon
end
end
diastolic volume.
diastole.
Okay. And what is stroke volume?
Stroke volume is amount of blood ejected with each heartbeat.
End diastolic minus end systolic volume. So lesser is the end systolic volume, more will be the ejection fraction. Wonderful. So your answer is absolutely correct. Answer is end systolic volume. So can you tell me in the pressure volume loop curve, the shift will be right or left?
I'm sorry, sir.
In the pressure volume loop curve, do you know what pressure volume loop curve of cardiac output?
Yes, sir.
So in that particular condition, if there is decrease in the end systolic volume, shift will be left or right?
Left, sir.
Left. Wonderful. What about right?
Uh, if increases, then
Increase in the preload. Very good.
preload.
If increase in the preload, then shift will be right. If increase in the contractility, or you can say decrease in the end systolic volume, shift will be left. And if increase in the afterload, then shift will be upward.
Upward.
Any other team want to comment on this question? Team A, Team D. Okay. So next question is, be ready. A 66-year-old man who has had a sympathectomy experiences a greater than normal fall in the arterial pressure upon standing up. The explanation for this occurrence is A. Exaggerated response of RAS, suppressed response of RAS, exaggerated response for baroreceptor, or suppressed response for baroreceptor.
Option D, a suppressed response of baroreceptor mechanism.
Wonderful. Why? What is your answer? Why? What is your reason for this?
Baroreceptor like acts through sympathetic system and controls the pressure. So if the sympathetic system is uh, like cut, then the baroreceptor mechanism would suppress, and the increase in the blood pressure wouldn't be maintained.
Very good, excellent. I must say, concept is very nice. So why not RAS? Why not? Why not? Why only Biro? Why not RAS?
Um, normal at normal like orthostatic changes, RAS doesn't play much role. RAS is mostly with the blood volume.
RAS is mainly long acting. I mean, it is very, very, immediate,
Huh.
and then intermediate, and then long acting. It is long acting RAS. So immediately, if someone is having this orthostatic hypertension, who is going to act first of all? Biro. And who is second in this chain? After Biro, who will work? Chemoreceptor.
Chemoreceptors
And then CNS ischemic response.
response.
Only after that, RAS will be activated. So it is a late response, we can say. So very good for team C also. I mean, 10 marks. Now, team B or team D? Who is
Sir,
this?
my teammate is back, so if you want to direct the question towards us, that would be fine.
Team A.
Team B, sir.
Okay, now you're team B. So I will ask team B only, okay?
Thank you,
So
sir.
you have to answer two questions, two MCQ in the first round. So this is the first question for you. A 30-year-old female patient ECG shows 2 P wave preceding each QRS complex. The interpretation of this pattern is decreased firing of SA node, decreased firing of AV node, increased firing of pacemaker in the SA node, decreased conduction through AV node, or increased conduction through his Purkinje system.
Decreased conduction through AV node.
Very good. What is this type of?
This is heart block where a beat is dropped after P wave. So
Which first degree, second degree, or third degree?
yes. First degree, second degree, or third degree?
Second
degree.
Second degree, Mobis 1 or Mobis 2?
Mobits 1. No, Mobits 2.
It is Mobis 2.
2.
And which variety? 2:1 or 3:1?
2:1.
2:1. Wonderful, wonderful. What happened in Mobis 1?
Usme the interval between PR keeps on elongating until a beats drop. So it's not equal. Here it's after 2 beats, 1 is happening, so it's Mobits 2.
I must say that your all students are very nice. I can see here that your concepts are really very good. Congratulations. I should make some tough question, I think. I was very skeptical about that. So very good. Question number 5 for team B. This is team B, na?
Yes, sir.
So 5 full marks. Okay, now next question. A acute decrease in the arterial blood pressure elicit. Which of the following is the compensatory change? Decrease firing rate of Calicut sinus, increase parasympathetic outflow of the heart, decrease heart rate, decrease contractility, decrease mean systemic pressure.
Decreased firing rate of carotid sinus nerve. तो फिर baroreceptor reflex.
तो फिर उससे पैरासिम्पैथेटिक बढ़ जाता है.
पैरासिम्पैथेटिक घट जाता है.
पैरासिम्पैथेटिक डिक्रीज हुआ ना, तो
Acute decrease in arterial blood pressure. तो
अच्छा LS हाँ डिक्रीज A.
What is the answer? A. So can you tell me the sequence of if there is less BP? What is the sequence?
Sir, जब BP गिरता है तो there will be reflex tachycardia.
Very good. What is that called as? Mary's law. So when
law.
BP is low, stretch is low, firing is low.
Decreased firing of the baroreceptor, तो वो rostromedia center और CVM वगैरह का से parasympathetic output कम हो जाएगा, sympathetic increase हो जाएगा.
Parasympathetic कम हो जाएगा, sympathetic will be more. So heart rate will be more, you can say. So answer here is A, of course. So this is for team B. This is team B, na?
Yes, sir.
Okay, so next team.
Team D, are you ready?
Yes, sir. Team D is ready.
Okay. During exercise, now this is a very simple question. During exercise, total peripheral resistance decrease because of effect of sympathetic nervous system on the splanchnic arteriole, parasympathetic nervous system on the skeletal muscle arteriole, local metabolites on the skeletal muscle arteriole, local metabolites on the cerebral arteriole.
लोकल वेसिकुलेशन होता तब अपन बोलते हैं ना टीपीआर टोटल ओवरऑल गिर रहा है तो सिंपैथेटिक सिस्टम करेगा तो वहां पे करेगा ना ये जिससे वहां पे ओवरऑल ब्लड ग्रुप हो जाए फिर उसके बाद सब में बढ़ जाएगा में क्यों करेगा ना तो पहले से वहां पे ब्लड चल जाएगा ना वहां पे ब्लड चल जाएगा तो अपना ओवरऑल कम हो जाएगा ना ठीक है ऑप्शन ए
sympathetic nervous system. Are you sure? Sympathetic
C option C. We'll make it final option C.
Okay, what should I do now? Should I count it yes or no? Answer is actually C. But first you opted for option B, A, I mean. Yes, moderator should comment on this.
Sir, if they finalize the option the first time, we'd have to consider that as their answer. Did they finalize the option the first time?
Okay, so that will be a 0 marks then.
Yes.
Okay, no problem. So now we know that there is systolic blood pressure, there is diastolic blood pressure. Systolic blood pressure depends on cardiac output. Diastolic depends on total peripheral resistance. And whenever we exercise, yes, team D, whenever we exercise, diastolic BP increases or decreases? When we exercise?
So decreases.
Decreases. Very good. Why? Because all the blood will go to the muscle.
Yes,
all go to the muscle. सारा blood muscle को चला जाएगा. And total peripheral resistance will be less, isn't it? And this is the reason, because of the local metabolites. The arterioles are not sensitive to all other factor, but to the local metabolites like potassium, like adenosine and all those things. So the important thing is here that whenever we do exercise, diastolic BP decreases and systolic BP increases. Now question number 2. A newly developed local anesthetic blocks sodium channels in the nerve. Which of the following effect on the action potential would it be expected to produce? Decrease rate of upstroke, shorten absolute refractory period, abolishes hyperpolarization after potential, or increase sodium equilibrium potential. It is about local anesthesia.
Sir, option A.
Option A, very good. So we know that depolarization is because of the sodium, of course, and if you block the sodium channel, it is going to affect the upstroke. So answer is A, absolutely correct. And what about shorten the absolute refractory period? It will be shorten, or it will be, it become more. It become more, na?
Lengthen it, sir.
Okay. So this is 2 question for D. Now which team is there?
Team E.
Team E. Okay. So I hope you are ready now.
Yes, sir.
Okay. An inhibitory post-synaptic potential, IPSP. This is a frequently asked MCQ for exam. Depolarizes post-synaptic membrane by opening sodium. Depolarizes post-synaptic by opening potassium. Hyperpolarizes the post-synaptic by opening calcium, or hyperpolarizes by post-synaptic by opening chloride. Direct question.
Option D, sir.
D, very good. So we know that there is EPSP and there is IPSP. Both are type of what? Local potential or action potential? They are type of local potential.
Local potential, sir.
And local potential can be, they don't follow all or none law. They can be added also, they can be subtracted also. Summation is possible. So when they summate together, because of influx of cation, they can cause EPSP. Okay. Otherwise, they can cause IPSP. So when they cause EPSP, they cause depolarization because of cation. And whenever they cause IPSP, it is because of the anion. So answer here is hyperpolarizes the post-synaptic membrane by opening of the anion, that is chloride channel. Very good. Next question. Which of the following would occur as a result of inhibition of sodium potassium pump? Decrease intracellular sodium, increase intracellular potassium, increase intracellular calcium, or increase sodium glucose transporter.
Option B, sir. Increased intracellular potassium.
Increase what is the mnemonic? Nokia. Sodium ko out and potassium ko in. If you block, it will be less, na? Okay, let me tell you what is the function of digitalis.
Inhibits the blocks the sodium potassium pump, sir.
So what happened when it blocks sodium potassium pump? What happened? It also blocks sodium calcium exchanger, isn't it? So now if sodium calcium exchanger is inhibited, calcium will not go out. Calcium will increase in the heart, and that is why it causes positive inotropy, isn't it? So it will increase sodium intracellularly, decrease potassium. Opposites are given, you can see here. So the answer will be increase intracellular calcium concentration, isn't it?
Yes, sir.
So answer will be C, because this question is directly from digitalis. The effect of digitalis is to block sodium potassium pump, and sodium calcium exchanger is depending on the energy of this pump. And if you block this pump, now calcium will not go out in place of sodium. Calcium will be, accumulated in the cell, causing positive inotropy. So answer will be C. So I think I asked 2 questions now.
Yes, sir.
Okay, so there are 5 team only, na?
Yes, sir.
What is the score? Can you tell me?
I request the scorer to please read out the scores of each team.
Hello.
Yes.
It's 10 points for team A, 10 points for team B, 10 points for team C, 5 points for team D, 5 points for team E.
Okay. So in the second round, again, I will ask MCQ only. So now team A, are you ready?
Yes, sir.
Okay. Which of the following temporal sequence is correct for excitation, contraction, coupling in the external muscle? Increase intracellular calcium, action potential in the muscle membrane, cross bridge formation, action potential in the muscle, depolarization of the T tubule, release of calcium from reticulum, action potential in the muscle membrane, splitting of ATP, binding of calcium to troponin C, or release of calcium from reticulum, depolarization of T tubule, binding of calcium to troponin C. What is the sequence, correct sequence?
Sir, it is option B, sir. Action potential in the muscle membrane, then depolarization of the T tubules, then release of calcium from the sarcoplasmic reticulum.
Very good, excellent. So we know that when after NM junction transmission, action potential goes in the muscle, then goes inside the T tubule. And which receptor is on the T tubule?
Ryanodine receptors.
Ryanodine receptor. It communicates with which receptor? Dihydropyridine receptor. And when they communicate, they cause release of calcium. Calcium bind with what? Troponin C. What is the whole sequence? Can you tell me the whole sequence when calcium is released? Yes, doctor, tell me the sequence.
Sir, you are not audible. Can you come again, sir?
I'm asking the sequence. When calcium is released, what happens?
Then it will troponin binding will happen, sir.
Calcium binding troponin
Cross bridge
C.
formation.
Okay, it causes conformational changes and it uncover myosin binding site on the actin, and then actin myosin bind in contraction. Okay, next question. Which of the following transport processes is involved if transport of glucose from the intestinal lumen into small intestinal cell is inhibited by abolishing usual
Sir, we are
sodium?
not able to get the question.
You're not able to hear me or see the question?
Team A, can we make sure your network is proper?
It is 11. Now only we can hear, sir.
Okay.
Am I audible
Yes,
now?
sir.
Can you see the question?
Yes, sir. Now we can see it.
Okay, tell me the answer.
Sir, time started?
Yes, time started, of course. Simple diffusion, facilitated, primary active, co-transporter or controllable.
Sir, is it option D, co-transport?
Okay, which channel is this?
Sir, normally it goes through facilitated diffusion, but it is being abolished here, usual sodium gradient. So it will go through co-transport. Primary active transport requires direct ATP, which is not to be there.
What is the name of that channel?
I'm not sure, sir.
Have you heard about SGLT1 and 2?
Yes, SGLT. But
Is it SGLT1 or 2?
One, sir. 2 is in kidneys.
So in kidney, both are there, 1 and 2 as well, but in intestine, there's only 1. Okay, what are the drugs which are SGLT2 blocker?
Canagliflozin, dapagliflozin.
Dapagliflozin, empagliflozin, good. And what is the best important, you can say side effect, but it can be used in the patient? If you give SGLT2 blocker, what is the best effect of this drug beside controlling blood glucose?
Because like heart failure with reduced ejection fraction can be treated.
The thing is that SGLT not only decreases HbA1c but also decreases glucose, so it decreases body weight, because normally sulfonylurea, pyridazole, all these are increasing body weight. Either you give insulin or you give PPR gamma agonist, almost all drugs are going to increase your body weight. Only 2 drugs can decrease body weight. One is SGLT2 blocker, other is GLP-1 agonist, isn't it? Okay, so this answer is correct.
Excuse me, sir. I'm from Team C. Can I interrupt?
Yes, sure.
So in the 11th question, like I feel the answer should be B and not C.
They were told na B, na?
Okay, so the answer is B, right? Or B
Yes,
for
answer is
Bombay.
B. Yes, B for Bombay.
Okay, sir. Thank you.
Just team A, you have answered D, na?
Did-
Yes, sir. We said B. Option B. B for
B for
Bob.
Bombay, na?
Okay, sir.
B
My
for
bad.
Bombay.
Sorry, sir.
Okay, no problem. Okay, is this clear? Any team can ask the doubt or whatever they want to comment, please. You are okay. So team B not ready?
Yes, sir.
In
How many
skeletal
marks do we get for this question?
yes.
Polarization of the tubules.
Team A, can you please mute yourself?
हाँ हमारा चांस है.
Okay. In the skeletal muscle, which of the fall? I think I have given more time to you. Should I change this question? Okay, I will change. Blood level of which of the following substances decrease in grave disease?
TSH.
Okay. Okay. What are the other thing you can see in the grave disease?
सर T3 T4 increase हो जाएंगे.
Graves ophthalmopathy.
Which is the pathognomic? मतलब कौन सा ऐसा जो pathognomic for grave disease? Characteristic of grave disease. How can you say it is definite a case of grave disease?
Eye changes.
Yes.
Proptosis.
Ophthalmopathy. Graves ophthalmopathy.
Any lab test? Of course, proptosis is there. कोई lab?
Antibodies.
Which antibody?
Long lasting.
And वो thyroid के against autoimmune.
Against thyroid receptor.
Against or with?
It stimulates.
It's type 2 hypersensitivity.
Grave disease is an autoimmune disorder.
Yes.
Hashimoto is autoimmune disorder. But the one is causing hypothyroid, other is causing hyperthyroid. What is the reason?
The against one causes क्या कहते हैं hypothyroid. This antibody acts on the receptor and stimulates it, thus causing hyperthyroidism.
It mimics
Yes,
TSH.
It is called last, like it was earlier known as last.
Yes, it is TSH stimulating immunoglobulin, TSI. It is pathognomic for the grave disease. It is only increased, and antibody against TPO is found in Hashimoto disease. So the pathognomic test will be, of course, your TSI. And TSH will be, of course, less in the grave disease. Next question. Which of the following hormone act by inositol triphosphate calcium mechanism of action? 125 dihydroxycholecalciferol, progesterol, insulin, parathormone, or GnRH? First is vitamin D3. I mean, calcitriol, progesterone, insulin, parathormone.
GnRH.
Okay, what is the rationale behind this?
Most of the releasing hormones act via IP3 calcium GQ receptor.
Except
Thyroid releasing hormone which acts via
the nuclear receptors.
No. CRH acts via G alpha.
GS is very good. What about vitamin D3? Vitamin D3, A option. Which receptors it is acting on? A receptor, option A.
Progesterone to intracellular, insulin, tyrosine kinase, vitamin D3,
Nucleus.
nuclear.
And what about parathormone? GS. Almost all TH are GS only. Okay, ACTH and all TH. Insulin plus growth factor are tyrosine kinase. All growth factor except TGF beta. All are receptor tyrosine kinase. Okay, and vitamins A, vitamin E, then thyroid, all these are nuclear. Rest steroid are cytoplasmic. And all releasing hormone are GQ except CRH. Very good. I must say, you all are in first year, of course.
Intern.
Okay. I was told that I have to. Okay. So two questions are clear now. This is now team C.
Yes, sir.
Okay. I was not knowing that. I think that I was informed that I think I have to take quiz of first year only. That's why I have taken this simple question. No problem. Secretion of oxytocin is increased by milk ejection, dilatation of the cervix, increased prolactin level, increased ECF volume.
Option B, dilatation of cervix.
Okay. Why not A?
Milk ejection, milk letdown reflex, oxytocin helps in milk letdown reflex.
Hmm.
It's not increased.
You are correct. This is the response, not the stimulus. है
Yeah,
ना?
sure.
Dilation of the cervix and nipple stimulation are the stimulus by which oxytocin is released, and oxytocin causes milk ejection.
Yes,
So
sir.
milk ejection is the response, you can say, and dilation of the cervix is the stimulus they are asking for. Very good. Next question. 61-year-old women with hyperthyroid is treated with propyl thiouracil. The drug reduces the senses of thyroid hormone because it inhibits oxidation of.
Uh, Sir, propyl thiouracil has two actions. It also decreases peripheral conversion as well.
Yes, you are
So
correct.
it inhibits oxidation of TPO. Like,
What will be your
so it
answer?
reduces synthesis of thyroid hormone because of oxidation of. I would go with option C, sir. Diiodotyrosine.
Okay. Actually, see, if you remember, TPO have three action. One action is what? Oxidation of iodide into iodine. Number two is the coupling reaction. Number two is the organification. Number three is the coupling reaction. All
Yes, sir.
three reactions are done by which one? TPO only.
TPO only, sir.
And propyl thiouracil is inhibiting TPO. So it will inhibit organification, it will inhibit coupling, and it will inhibit oxidation of iodide into iodine. So answer will be E.
So, but option C, like diiodotyrosine, like it will prevent organification, like coupling also now. So, like,
No, no, question is it inhibit oxidation. Question is not it inhibit. Question is it inhibit oxidation of. If
okay,
question is
sir.
having it inhibit, that it inhibits coupling also, it inhibit organification also. The
Okay,
first
sir. No. Okay, sir. Okay, sir. I got my
when
answer.
iodine get inside by the pendrin protein, if you remember the pendrin protein, it is thrown inside the lumen. Okay.
Yeah, sir. I got the answer.
Okay, so
Thank you.
answer is E. Am I clear? And you are very correct that propyl thiouracil also inhibit the peripheral conversion also. Very good. Which one more drug? Propranolol. Why propranolol is given in thyrotoxicosis, not metoprolol, atenolol, any other drug?
Same action. Peripheral 5' deiodinase inhibition.
Okay, wonderful. Very good. Very good. So answer is E. Which is the next team?
Team D, sir.
Team D. You're ready?
Yes, sir.
Question number 1 for you is, which of the following is the site of sodium bile acid co-transport?
Sir, option D, ileum.
Good. So you know that B12 and bile, BB, almost all things are absorbed where in the jejunum, except something from the duodenum and something from the ileum, like vitamin B12 from the ileum and iron from the duodenum. So along with the B12 bile acid also, it is called as enterohepatic
Intrahepatic
circulation.
circulation.
Okay, good. Next question. Which of the following is the step in photoreception in the rods? Light convert all trans into cis. Metal adoption to activate transducin. Cyclic GMP level increases. Rod depolarizes. Glutamate level increases. What happens when light falls on the rod?
Sir, option E.
Glutamate level increases. No, answer is B. See, whenever light fall, I will tell you all the step. Whenever light fall, cis retinol is converted into trans retinol. How? By a cycle called as BLMM. Bathmorhodopsin into lumirhodopsin into metalrhodopsin 1 into metalrhodopsin 2. Metalrhodopsin 2 will activate transducin, which is actually a phosphodiesterase, which will convert cyclic GMP into GMP. And rods are having cyclic GMP dependent sodium channel. So now cyclic GMP dependent sodium channel will be closed. Instead of depolarization, there will be hyperpolarization and glutamate level decreases. This is the exception in the whole medical science and also in the essay note, it is the hyperpolarization which is activating the bipolar nerve. There are rod and cone, then bipolar, then ganglion cell. So normally, whenever you activate something, there is depolarization, but vision is the exception. Because in the dark, what happens in the dark? Rods and cones have cyclic GMP dependent sodium channel. So in the dark, sodium keep on coming inside, causing depolarization and causing more glutamate. In the dark, there is less sodium, there is hyperpolarization, and glutamate level will decrease, not increase. Cyclic GMP will be less. Rod will hyperpolarize. Okay, so answer will be B. Metarodopsin activate transducer. Okay.
Yes, sir.
Anyone, any other team want to comment or any doubt you can ask? Okay, next question. I mean, next team. Which is the next team?
Team E, sir.
Team E. Okay. Pathogen that produces fever cause decreased production of interleukin, decreased set point, shivering, vasodilation of the blood vessel in the skin.
Option D, sir. Vasodilation of the blood vessels in skin.
Answer is C. Actually, shivering and vasoconstriction. See, whenever there is infection, I will tell you step by step. Interleukin will be released. Okay, they will get inside the hypothalamus. In the hypothalamus, they will confuse the set point. Set point will increase.
Yes,
And that increase in the set point will cause shivering and vasoconstriction. On the other hand, if you take paracetamol, it will decrease set point. It will cause what? Sweating and vasodilatation. So shivering and vasoconstriction is the medium to increase the temperature. On the other hand, what? If you see the sweating is there, fever come down. So sweating and vasodilation is to decrease the fever via paracetamol or any other drug. Shivering and vasoconstriction is the method to reduce fever. Okay. Question number 2. Which of the following causes a decrease in renal calcium clearance? Hypoparathyroidism, treatment with chlorothiazide, treatment with furosemide, ECF volume expansion.
Option B, sir. Treatment with chlorothiazide.
Very good. So you know that thiazide causes increased calcium reabsorption, and furosemide causes increase in the renal calcium clearance. That is why it causes renal stone,
Yes,
isn't it? Nephrolithiasis, and that is the reason the drug of choice for nephrolithiasis is thiazide, isn't it? We are giving thiazide for treatment of nephrolithiasis, and thiazide is similar to Gentleman syndrome. Furosemide is similar to the Bartter
syndrome.
syndrome, isn't it? That is why nephrolithiasis is common in Bartter syndrome and tetany is common in Gentleman syndrome. Can anyone of all the team tell me the rationale of that patient is presenting with the tetany in Gentleman syndrome? I was not knowing that. Just tell me the answer. किसी को पता है कि why thiazide, I mean Gentleman syndrome, the presenting feature is tetany? Yes, please.
सर हाइपोकैल्सीमिया होगा तो फिर टेटनी हो जाएगा।
लेकिन इसमें तो कैल्शियम बढ़ रहा है ना, थायराइड तो कैल्शियम को बढ़ा रहा है। यही तो पूछना है मुझे कि कैल्शियम ज्यादा हो रहा है, कैल्शियम इज मोर, इवन दो कैल्शियम रीएब्जॉर्प्शन इज मोर देन टू पेशेंट प्रेजेंट विद टेटनी. Actually, I made a question according to MBA first year. Otherwise, I would have taken the clinical question. I was not knowing that. Anyway.
Due to metabolic alkalosis, it will also lead to binding of more calcium with albumin.
Do you know in Gentleman syndrome there is hypomagnesemia also? Yes or no?
Yes, sir.
Any case in pediatrics, if you see, only if hypomagnesemia, then only you make the diagnosis of Gentleman syndrome. So now next question, why hypomagnesemia is going to cause tetany? Why hypomagnesemia is going to cause tetany?
So magnesium binds to the calcium channels 2.
Like,
Okay, let me tell you.
magnesium absorption increases, calcium will be excreted. So hypocalcium
Magnesium is required for parathormone release. And if magnesium is less, parathormone will be less and free calcium will be less. Even though total calcium will be more in Gentleman syndrome, but free calcium will be less. Why? Magnesium is required for release of parathormone. Am I clear? So presenting feature of Gentleman syndrome is tetany, and presenting feature of Bartter syndrome is nephrolithiasis. Okay. So I think two rounds are over now. We have finished with the 2 round now. Everyone?
Yes, we have finished the second round. The scorer, please, could you read out the scores for the second round?
Score: Team A 10 points, Team B 10 points, Team C 5 points, Team D 5 points, Team E 5 points.
Okay. So should I start with the rapid fire round with team A? I will ask 5.
All the
Sir,
teams, are you sure about the rules for the rapid fire round?
like, can you please reiterate them once? Can you please tell us the rules again?
Yeah, sure. For the last round, it's a rapid fire round. So each team will have 5 questions, and they will get 5 seconds to. I mean, they'll get 5 seconds to answer each one of them. 5 questions, 5 seconds to answer each question, and 1 mark will be awarded for each right answer.
Yeah, can you tell scores again, please? Like, the scores of the teams.
The score is team A and B 10 marks, rest all are having 5 marks.
Okay, thanks.
Okay. Should I start? Team A.
Yes.
From which college you are? This is not the question, I mean. This is just
Madras Medical College.
Madras. Okay.
Yes.
What is
Madras
your name?
Medical College, MMC.
Name?
Karthikeyan, sir. Karthikeyan.
Karthikeyan and second?
Karthikeyan, sir.
Tamil Prakash.
Okay. So let me ask question number, rapid fire one. Listen very carefully. You have only 5 seconds to answer. Okay. Please, scorer,
Yes,
ready.
sir.
Question number 1. Epsilon cell of pancreas secrete which hormone?
Amylin.
No, it is ghrelin. Okay. Hyperglycemia during night and hypoglycemia during early morning is called as which phenomena?
Dawn and slow motion.
Yes?
Dawn and slow motion.
No, it
If
is dawn or
insulin
slow.
therapy is given, it is soma. If insulin is not given, it is dawns.
It can be one only. I will tell you the reason. Either somogo or dawn.
Can you tell the question answer?
Hyperglycemia during night and hypoglycemia
Yes, sir.
during early morning is which phenomena?
Dawn phenomena.
It is somogamy phenomena. See, in somogamy phenomena, you are taking so much insulin that at night there is hypoglycemia. In the morning, you have reactive hyperglycemia. Okay, question number 3. Only excitatory nucleus of the cerebellum is. Which is the only cell of the cerebellum that release glutamate, that is excitatory.
Cells or nucleus?
Nucleus or cell, same thing.
Time's up.
Yes.
Cell in the sense it will be granule cells.
Granules, a very good, correct answer. Answer 3 correct, please note down.
Okay.
Which is the only excitatory.
So can you please wait a minute? We have lost the internet connection.
Sir, can you give a minute, please? There is
Okay, sure.
Internet
connection
issues.
lost.
Okay, no problem.
1 minute, sir. We cannot see anything. That's why.
Sure.
Sir, actually the time buzzer went off in the third question. Like the guy shouted "Ke time up." Afterwards, they told the answer. So
Okay, it depends on the scorer. Whatever they score, they write. I will tell. But there's internet issue also with team A, I think.
Yes, sir. The time cursor was off before they said the answer.
Team A, you are okay now? There is some net issue with team A, I think.
Sir, maybe we could continue with the next team
Okay, next.
and wait for team A.
Okay, I asked 3 questions with team A, na? Only 2 are left.
Yes.
Okay, team B. Yeah, you are from which college?
Sir, AIMS Bhopal.
In Bhopal, acha. And what is your name?
Rishti.
Shrutangi.
This
Shrutangi.
recently I was in. Okay, good. So listen very carefully. Question number 1 for you, which is the only cell of basal ganglion or nucleus of basal ganglion that is excitatory.
Indirect pathway में
Subthalamic.
Time's up.
Correct. It is subthalamic nucleus, and lesion of subthalamic nucleus causes what? This is not a question. I'm just discussing that. Lesion
Huntington's.
of yes,
Huntington's chorea.
Bellismus, hemibellismus and bellismus. Okay. Question number 2 for you is Parkinson disease is due to lesion of.
Substantia nigra.
Correct. Amount of air present in the lung after normal expiration is.
FRC. Functional residual
Wonderful.
capacity.
Very good. Question number 4 for you. Maximum amount of air you can expire after taking full inspiration is called as.
Full lung capacity.
Inspiratory capacity. Total volume or
Time's up.
Wrong. Vital capacity. It is vital capacity. Question number. This will be 5th question for you.
total volume. Yes, sir.
So gene present on Y chromosome responsible for sex determination is.
SRY gene.
Yes, good. Correct.
Game girl.
Team C.
Yes, sir.
You are from which college?
BJ Medical College, Ahmedabad.
Ahmedabad. Wonderful. क्या नाम है आपका?
Nishid.
Nishit.
Yes, sir.
You all are intern. I mean post intern.
No, sir. I'm from third first.
Third. Okay. जो मुझे पता नहीं था तो मैंने क्वेश्चन फर्स्ट ईयर के हिसाब से बनाया था. Otherwise I must have made clinical integrated question. But no problem. So next question for you is loop diuretic work on which channel on TA?
Sodium potassium 2 chloride.
Correct. Very good. Liddle syndrome is due to mutation of which channel?
Amyloid channel. Amyloid channel. Amyloid. ENaC.
Time's up.
ENaC.
It was gain of mutation of ENaC actually.
Sir, I said ENaC.
Okay. Third question for you. Serum calcium is increased and serum potassium is decreased by which hormone?
Vitamin D.
No, it is pyrrole hormone. Vitamin D3 increases calcium also and phosphate also.
Phosphate.
Next question for you. This is the 4th question, I think, na?
Yes, sir.
Pre-potential of SA node is due to influx of which cation?
Sodium.
No, it is actually slow sodium, but T calcium. The answer is mainly T calcium and slow sodium. So I think 5 questions are over for you, no?
4 questions, sir.
4. Okay, next question. Time since injury to the formation of secondary platelet plug is called as?
Bleeding time.
No, it is clotting time. Bleeding time is the primary platelet plug, okay?
Yes, sir.
Okay, now team C. No,
Team D, sir. Team D.
Team D, you are ready?
Yes, sir.
Okay. Mutation of glycoprotein 1B9A will cause which disease?
Bernard-Sollier syndrome.
Bernard-Sollier
Syndrome.
Okay. Mutation of 2B3A will cause which disease?
Glandular thrombocythemia.
Glandular thrombocythemia. Okay. Testosterone is converted into estrogen by which enzyme?
Aromatase enzyme.
Aromatase enzyme. FeV1 by FVC is less than 70% in which disease?
Obstructive disease, emphysematous.
Okay. How many questions you done?
4, sir.
4. Last question. Which is the first parameter to decrease in small airway obstruction?
RV.
Time's up.
No, it is maximum mid-expiratory flow rate. MMEFR is the first parameter. Even before FE1 by FEC, it is the first parameter. Okay. Then team E, I think.
Sir, we are team A, sir. We have joined back.
Team A.
Came through another device.
2 questions were left for you, no?
Yes, sir. 2 questions were left.
Okay. Anosmia can be due to fracture of which plate?
Cribriform plate.
Plate of ethmoid.
Cribriform plate of ethmoid.
Okay. Atrial contraction on the rigid ventricular wall which produce which heart sound?
S3, sir. Normally it is S3, but S4 is the pathological sound.
No. It is
Time's up. Time's up.
It is S4 actually. S3 is due to hyperdynamic circulation, passive filling. Passive filling is causing S3 actually. And active filling causes S4 in the old age, like acute MI and all. Okay. So 2 questions are over for you now.
Yes, sir.
Now, who's the team E?
Team E, sir. Yes, sir.
Pacemaker cell of the respiratory center is called as?
Sir, could you repeat that, please?
Pacemaker cell of respiratory center is called as? Time's up. Pre-Borzinger.
Time's up.
Pre-Borzinger complex it is, okay. Question 2. Pacemaker cell of the GIT.
Interstitial cell of Kajal, sir.
Correct. Total body water is how much percentage of body weight?
70%, sir.
60%. Normal value of GFR is?
90 to 125 milliliters per minute, sir.
What are the incretin hormone? Incretin hormone.
GLP-1, sir.
And? And GIP.
Yes, sir.
Okay. 5 questions are over?
4, I think, sir.
4. Okay. What is the formula of clearance?
Cockcroft-Gault formula, sir.
Clearance, only clearance.
Amount of substance, arterial minus venous concentration divided by the flow rate into the organs.
That is cardiac. This is a fixed law you are telling. It is
RPF, sir.
urine,
Divided by RPF.
substance in the plasma into urine flow rate. That is the clearance, isn't it?
Okay.
Time's up. Time's up.
Time's up. Okay. Now can I know the final score?
Scorer, could you tell the scores of round 3 and then the final score of each team?
Scores of round 3 rapid fire. Team A 2 points. Team B 4 points. Team C 2 points. Team D 4 points. And Team E 2 points.
Sir, could you clarify which questions I have been awarded points for? Team E.
Team E. How many points you got? How many points for Team E?
I think they said 2, sir.
One was cribriform plate, I think.
No, sir, that was not my set.
Okay, that was not. Your was
pacemaker cells, sir.
Pacemaker cell 1 was correct for respiratory. No. You told GIT pacemaker correctly.
Yes, sir.
And one more question you have told correctly. That was total body water was 60%. You told 70%. Okay.
Okay.
So two were correct, I think. Clearance question was wrong for you.
Clearance, sir?
Clearance was substance in urine upon substance in
No, sir.
plasma.
I think you'd asked the normal clearance value.
Clearance for then you were asking the formula you had given was cardiac output.
No, sir. Before that, you'd asked normal clearance value, sir.
Normal clearance value.
Yes, sir.
And how much the answer you told you?
I had given a range, sir, 90 to 125. I had mentioned.
I don't ask this question, Nathan. I have not asked this question.
Sir, you can ask anyone else in the meeting, sir.
Do I ask this question also?
So actually, the fifth question was what is the normal GFR rate was the question you asked, and you actually asked 6 questions in this set instead of 5, sir. So the clearance was an extra question.
Yes, clearance. Okay. So how many answers are correct now? For E?
Third question I think you asked was incretin hormone, sir.
Yeah, incretin phenomena. Yes. So that was correct.
The team still has 2 points.
So team E has 3 answers correct. Okay.
No, sir. 2 answers are correct.
2 answers or 3 answers were correct. Incretin answer was correct. He had told incretin also. He had told the pacemaker also correctly. And also the normal value of GFR. 3 answers are correct for team E.
Hello, sir.
Yes, Rishika.
I couldn't hear you. Could you repeat it once more?
Yeah, I cannot hear you. Can you tell the final marking, the score of every team?
Hello, everyone. Am I visible? Hello?
Yes,
Okay.
now you are visible.
So these are the final scores. Team A, 22 points. Team B, 24 points. Team C, 17 points. Team D, 14 points. And Team E, 12 points. I repeat, Team A, 22. Team B, 24. Team C, 17. Team D, 14. And Team E, 12 points.
Excuse me. The final score for my rapid fire was 3 points, not 2.
3 points. Excuse me. Just clarify and be back right.
Well, almost every question you have answered correctly. Almost everyone. So it was very tough.
Team E, could you clarify which all questions you got correct for the rapid fire?
GFR normal value, the incretin effect, and the pacemaker cells of GIT.
3 questions were correct for team E.
Okay. So, sorry for that mistake. So, Team E will be getting 3 points in the rapid fire round, and the final score of Team E is 13 points.
Thank you.
Okay. So, that marks the end of round 2, the finals of Tangled MEDMEET 2.0. So, I would like to thank Dr. Naveen sir for being with us here today, despite his busy schedule. So, thank you for the quiz and the wonderful discussion that you held.
Thanks. Thank you, Lord. Thanks, everyone, for joining the quiz.
And I thank all the participants for participating in this quiz. And congratulations, everyone, for the wonderful performance that you all put forward. So, thank you. That's the end of round 2.
Excuse me, can we just know कि round 3 कब होने वाला है?
Round 3. We'll be updating you that in the group.
ठीक है. Okay. Thank you.
Thank you all. You can now leave the
Thank you.
meeting.